Hi everyone, my name is Heather. I'm one of the speech and language pathologists with Great Speech. I am here today to talk to you about some strategies for school-age children for fluency. So I'm going to go through a brief PowerPoint just sharing with you some strategies that you can do at home with your children. So when I am talking about school age, I am considering these children to be 6 to 12 years of age. So I've included some stuttering knowledge here just because I get asked frequently by parents some of these questions. So what we know about fluency right now is that about 8% of children have stuttering sometime during their development. Most recover completely either with or without speech therapy, but there's that 0.75 to 1% who continue to stutter. We don't really know the exact cause of stuttering, but there's a lot of research out there and a lot of theories. One of those theories is that there's a genetic disorder or link there. Things like parenting or life events or nervousness are not causes of stuttering. That's a very common misconception. Those things can definitely, though, increase pressure. Speech therapy tends to have a really high success rate in preschool children. Types of stuttering. So these are the core behaviors and the secondary behaviors, and chances are, if you are seeing a speech therapist, you've already discussed some of these things, but just for a brief overview, we're looking at sound and syllable repetitions, whole word repetitions, prolonging a sound, or blocks when a child cannot get that sound out. The secondary behaviors include things like head nods, eye blinks, foot taps, jaw tremors, and sometimes that visual struggle that you can see that your child might have with their muscular tension, maybe in their throat or in their facial muscles. Frequently, kids with stuttering will avoid or substitute a word that is difficult for them. They may use unfilled pauses and frequent interjections. Here are some stuttering tips for parents. So one thing that you can do as a parent is just focus on paying more attention to the message itself and how your child produced that message. Trying to do things like finish a sentence for your child, guess what they're saying, or provide simplistic advice like slow down or relax may not be helpful for a child who is stuttering and may, in the end, make them feel a little bit more stressed out about what they're saying. You can convey with your facial expressions, your tone of voice, and your body language that you're listening and that what they're saying is important to you. Slowing down your rate of speech for your child is a great thing we can do as parents to show kids what an appropriate rate of speech is so that people can hear what you're saying. Always praise your child for sharing their thoughts and ideas with you because having stuttering can make it really difficult for your child to say what they want to say to you. So our goal at this point is for stuttering management and successful communication. So these are things like decreasing severity, increasing how they feel about themselves, decreasing concern from familiar people, and then decreasing the overall functional impact. The first strategy that I'm going to discuss with you is called syllable time speech technique. So this focuses on rhythm to help induce fluent speech. There have been some studies with preschool children that it can reduce their stuttering by 96% over 9 months if they practice daily. How we do this is we say one syllable at a time, you break your words up into syllables, and then you put boundaries or pauses after each one. If your child struggles with this, you can have them tap their leg or the table for each syllable. An example sentence would be, I like ice cream. Activity ideas here include looking at picture books, playing with toys, and then having just normal conversation. Progressive muscle relaxation teaches your brain how to let your muscles relax, and it can be really helpful for implementing the next few strategies, which require you to be able to do that. So there are some YouTube videos that you can look up for muscle relaxation. This is often used in the mental health field. I would suggest for speech purposes, you start with the muscles in your cheeks and jaw. You can choose to do other muscles in your body as well. You tighten those muscles as hard as you can for 5 seconds, and then you let all that tension go. And you can repeat this 5 times. Stuttering modification techniques. The first thing that your child needs to be able to do is become more aware of what is happening in their body. So listen for words and decide together, did that sound smooth or was it bumpy? You can signal the word as being smooth or bumpy by using something like a thumbs up or a thumbs down, or you could have a toy that has a smooth or a bumpy surface. If your child's having difficulty, one thing that I often do in therapy sessions is we record a sample and then we listen to it together and decide together which words were smooth and bumpy, because sometimes kids can't even hear it in themselves that they're doing it. Again, here's some activity ideas, things like reading a book together. You'd start with words, sentences, and paragraphs. You can play with toys together, do a fun activity, or tell a story. The next technique is called the cancellation technique. This works on letting out tension and re-saying the desired word more fluently. This is where muscle relaxation is really important. So how you do this is when you stutter on a word, you stop and pause, you let the tension go or you're feeling the tension, and then you try saying the word again while stretching out the difficult sound. So for example, if you get stuck on the word cream in the sentence that we've been using, I like ice cream. Here are some more activity ideas for you. The next technique is called the pull-out technique. Similar to the cancellation technique, you're doing almost the exact same thing. The only difference here is that you're not stopping. You're just trying to push through the sound. So it would sound something like this. I like ice cream. And here are some more activity ideas for you, which will be in the handout. The third technique for stuttering modification is called preparatory sets, and this is the hardest of the three. So this requires that you are able to have some sort of awareness about which sounds you get stuck on and which words you get stuck on. So if you have a word that you know is coming up and you know that you will stutter on it, you're going to bring your attention to the area in your mouth or throat where you know that tension is going to happen. And when you get to that word, you're going to try to make that problem sound with less tension than you normally would and stretch out that sound. So for example, I like ice cream. Light bounces technique. So this looks at making stuttering repetitions as gentle, quick, and painless as you possibly can make them. So when you know a word that is coming up that you're going to stutter on, you're going to not stop this time. You're going to work through that stutter. So you're going to bring your attention to the area in your mouth or throat where you typically feel the tension. And when you get to the word, you're going to use light and easy contact on the problem sound. So this is really similar to preparatory sets. And I often get asked from children, like, what is the difference between these things? And really, with all the strategies for fluency, they're very similar. There's just tiny modifications that you're making. So we also look at communication attitudes and feelings. So one thing that you can have your child do when they're practicing with you is stutter on purpose. And it sounds counterintuitive, but really it's providing exposure therapy, trying to desensitize your child to what it feels like to stutter. So gives them a sense of control. You can also use this for practicing purposes because there are a lot of children who maybe don't stutter all the time or on every single sentence. Another thing that you can teach your child to do is self-advertisement. So maybe coming up with a phrase that they want to say or a sentence to share that they stutter with someone and that they might stutter during a conversation. This can be used to reduce any stress that they're feeling, and it allows them to think and speak more clearly. Confident eye contact is used as a desensitizing technique as well. just helps your child feel more confident that they can look at the person they're talking to while they're stuttering and it's okay. So you can have them make eye contact for about 3 seconds and then look away for 2 seconds. And it's great for them to practice it with you first because you're familiar to them and they will feel more comfortable than implementing that with somebody else. Support groups are also really great for children. It provides them with an outlet where they can talk to people who understand how they're feeling. Here are my references. So this information comes from Fluency School, the Ultimate How to Treat Stuttering package. On this next page here, the author is this SLP Steven, and here's the link to his website. He's got some really great resources, some great videos, and he happens to be a speech therapist that also stutters and understands what it feels like. The NSA and the Stuttering Foundation have been around for a very long time, and they have really great resources. And then the bottom 3 links are links for support groups for young children. So those are just a few of the more commonly used strategies. Those are the ones that I frequently use during sessions. Hopefully you find that additional information helpful and maybe seeing some examples and how you can implement them at home in activities. I always recommend that you reach out to your speech therapist if you have any questions. Thank you. Bye.